Up next on our YouTube channel, today we'll be talking about how you can actually test for clotting. Okay, you can test for blood clotting and the clinical correlations. Okay, those are the disorders of clotting. If you don't have, if your clotting mechanism is slowed or absent, okay, what will happen? Okay, but if you want to test whether somebody's clotting time is normal, how do you go about it? Okay, so that's what we are going to talk about in this lecture. Okay, so now testing for clotting, you can test for bleeding time. This is the time, how long does it take for the blood to actually bleed before it stops? Okay, that's the bleeding time. Then we have clotting time. We have to talk about how long does the clot form? Okay, how long does the bleeding stop? Okay, how fast? Sorry, how fast does the bleeding stops? Okay, then how about prothrombin time? We know we spoke about the extrinsic pathway, we spoke about the intrinsic pathway coming together to form the prothrombin activator, which converts prothrombin to thrombin. Okay, then how long does it take prothrombin, okay, to actually be converted to thrombin? That's prothrombin time. Then partial prothrombin time is basically half of that time. Okay, how long does it take for prothrombin to actually be converted to thrombin? Okay, then half of that time is the partial prothrombin time. Then how about thrombin time? Is basically how long it takes for prothrombin to be converted to thrombin. Then know that it's thrombin that acts on fibrinogen, converting it to fibrin, okay, thereby forming all those fibrin threads, okay, that form the clot. Okay, so now we have spoken about testing for the clotting time. Now let's talk about if your clotting time is delayed or absent, what are the clinical conditions? Now clinical correlates, also known as bleeding disorders, all right, because your bleeding is not being controlled the right way. We have hemophilias. Hemophilias is a sex-linked disorder resulting from the lack of prothrombin activator. Now if this prothrombin activator is lacking, prothrombin will not be converted to thrombin. Okay, now types of hemophilia include hemophilia A, which there's an absence of blood clotting factor 7. We have hemophilia B, which is the absence of blood clotting 9, factor 9. Okay, then we have hemophilia C, which is the absence of blood clotting factor 11. Okay, now symptoms of hemophilias are spontaneous and prolonged bleeding. You bleed for a long time before your blood actually gets to clot. Okay, and you might lose blood and even become unconscious or even die. Okay, now there's actually internal bleeding too. There's hematorosis and treatment of these hemophilias. Since hemophilias is due to the absence of these different blood clotting factors, if you replace these blood clotting factors in the body, you have conquered the problem. Okay, so treatment of hemophilia is by replacement of the missing blood clotting factors. Okay, you might take drugs or you might take concentrations of these blood clotting factors, artificial ones, to replace the ones that are missing in your body. Okay, then next we have purpura. Purpura is characterized by prolonged bleeding time with normal clotting time. Okay, your bleeding time is prolonged, okay, but your clotting time is normal. Okay, now there's spontaneous bleeding into the skin. Let me explain. There's stoppage of blood coming out, but now there's internal bleeding. Okay, so now there's prolonged bleeding time but a normal clotting time. Now spontaneous bleeding into the skin, known as purpuric spots, occur. Okay, at times there might be ecchymosis, and types of this purpura are thrombocytopenic purpura and thrombasthenic purpura. Okay, so that's it. Then we'll be talking about the last bleeding disorder. It's actually von Willebrand disease. Okay, now von Willebrand disease is actually inherited deficiency of von Willebrand. Okay, and von Willebrand is a protein necessary for platelet adherence. Okay, and if You know that for clotting to occur, there's platelet plug formation. Those platelets actually adhere together. Now, von Willebrand is necessary for these platelets to actually adhere together. Now, imagine that these platelets are not adhering together, then bro, you're bleeding to death, bro. Now, it is also caused by deficiency of factor 8, thereby leading to excessive bleeding, even in just mild injury, just small cuts. You go bleed. Okay, so that's like about von Willebrand disease. Okay, and that about that, we are done talking about the different tests, clotting, clinical correlations, Hemophillias, Purpura, and von Willebrand disease. All right, so I hope you guys enjoyed this tutorial. See you guys in the next one. Bye for now.